The question here is, does it matter if dry needling, you actually know what it did? You can substitute dry needling for anything that has a dramatic change. At the end of the day, yeah, I do think it does matter. We should have an understanding of science, because the essence of science is to know the truth so that it can be replicated in other important, relevant situations. But for the purpose of rehab, if you don't know why the needle worked, but you know it did because there's other objective measures, you may not know why the chiropractic adjustment worked, but now their neck moves, there's no pain, and they have restoration of strength through an objective strength test that someone else measures. Does it matter? What matters more than that is, are you now moving forwards with very, very traditional scientific reconditioning, strengthening, etc. Now that whatever was your barrier or your block to your arm or your leg performing in the way that it should, to continue to develop or be in a position to, you should have a belief that, okay, if I do this, these muscles can adapt and I can go back and always do this test. That matters far more as to why the needle worked. But yeah, I do think it's important to know that what the needle works. I just don't know that you're ever able to say it was these two but not this one, or a conjunction of other things that would be far more neurotransmitter related of when any type of passive therapy seems to be magical. So as it relates to dry needling, do patients ask, this is obvious that this worked amazing, like what happened? Really what I say a couple things, or sometimes also before the treatment, because I certainly don't know that it's gonna work. I'm just using the needle instead of my hands. And what do I think both my hands and needles can do? It relaxes tissue that is temporarily contracted. Why is it contracted? That can be for a number of different reasons. A protective approach, some type of autonomic level of tension that is just never recovered. And then there's something called the energy crisis theory. A theory can't be proven correct, has not been proven wrong. That would then cascade as to, if I do ischemic release with my thumb or put a needle into an area that I think has these certain criteria, then the energy crisis theory would suggest that also, like, this blood flow is related to oxygen, and oxygen, once the cell is restored to its normal metabolism because of this micro injury, that normal metabolism is enough to create this relaxation of tissue. Acetylcholinesterase is involved, whereas if there's not acetylcholine, the cell is not able to relax from these two, from a motor synapse. There's a lot going on, and those are not things that I get into with the patient. These are things that I've just learned. It's hard to say that these are things that have been proven. These are all things that can be shown in research. But more importantly, what I would tell the patient is that, yeah, the needle allows tissues to relax. You're able to move your joint in a different way, and your brain perceives that motion to be a little bit different.